Hello, I'm Dr. Vandana Katyal, specialist orthodontist from Sydney, Australia, and today I'll be taking a few minutes of your time going through how you can access my coaching and mentoring services via our company BOSS, which is Best Orthodontic Seminars and Sessions. For those who are not in Australia and not our annual attendees, you will have to go online first, read our disclaimer statements, choose which coaching you want and pay for it first. You can choose between level 1 or level 2. And just before we begin, a disclaimer: please deem all advice given by myself is based on my own specialist orthodontist opinion, evidence that I have perused, and also my experience. This advice is simply a recommendation, and you, as a treating doctor, are solely responsible for your own patient's examination, diagnosis, treatment planning, the progress, the retention phase, and final approval of all my recommendations and suggestions. So when you go to our coaching page on our website, you can choose between level 1 or level 2. Level 1 is really designed for confident users who are just looking for a quick digital setup or clear aligner setup for their clear aligner patients. And if you want a quick second opinion for a fixed appliance patient, the diagnostic and treatment planning report can also be provided. Level 2 is really allows you to build confidence and learn. So it's not only what we do in level 1, but you also receive a 1 hour one-on-one online session with myself based on your case. So you get a lot of value. So for those who are not in Australia and still want to learn how to do things well in your everyday practice, level 2 might be a good way for you to go. So for those who are annual attendees of our Total Immersion program, we offer complimentary unlimited coaching for the first 2 cases, plus a full day attendance at a business coaching seminar as well. So let's get started. Well, step 1 is to really create some user accounts so Boss and myself can access these without too much trouble from you. And also, I want to make sure that you understand how you can share your clear aligner setups. So if you're an Invisalign user, please go into your Doctor ID, click on Account, click on Staff, and click on Add New Account. You will then create a new staff username under your Doctor ID called Boss Ortho with the password Boss Ortho 1 starting with capital B. Once you've done so, have a look at the right hand side column and you're going to tick all the boxes except the third one. So leave the one that says that this staff has the ability to approve a ClinCheck. Please leave that blank. This is to save you from any mishaps or accidental approval by us. So click on create and our new account will be created, but please make sure that you do email us your Invisalign Doctor login ID or username, and then we will be able to access as a staff member under your ID. For Australian Invisalign users, some of you might have your Doctor ID via Southern Cross Dental. Please note this is, in my opinion, a limited software version of Invisalign's ClinCheck, and I may not be able to complete your clear aligner digital setup or show you visually some of the tips that I can give to other users who have AlignTech accounts. So my suggestion is to move to an AlignTech Doctor account as soon as possible, not only for ease of use for yourself, but also the enhanced learning it can provide via BOSS. And this is simply based on my personal experience and professional experience and opinion. However, if you are really at crossroads and really wanting help, I may still be able to provide you some general planning advice and just a little bit of direction for your digital setup. So if you're a ClearCorrect provider and wishing to do this case in ClearCorrect, make sure you use the share link option to share digital versions. And now each setup has its own share link. So make sure that you're providing the latest version and the correct link. Once you click on share link, a web URL appears, and make sure you copy that and email that to us or embed that in a document or a PowerPoint for us. You will have a boss coaching template available online very soon. If you cannot see it online on our coaching page, then please email us and we will email that to you straight away. It's a PDF document that guides you as to how to collect all the information. So the next step is collecting all your information, your examination notes, your records, assimilating it all and organizing it. So when it comes to photographs, please make sure you provide minimum of 5 intraoral and 3 extraoral photographs. Please make sure the frontal photographs are taken in natural head position, with the patient's eye looking straight ahead at the camera and with the two ears projecting equally, so you do not produce any movement, rotation, or asymmetry. Make sure the lips are in unstrained position and not forced or closed. Your occlusal mirror shots should be flipped vertically before submission, so there's no confusion or distractions. When you take your intraoral buccal and frontal shots, if they're taken with direct vision, please make sure that you retract so well that we can go back and see up to the distal cusp of the first molar at least. Make sure the occlusal plane is parallel to the floor or edited in that manner. And please make sure that the photographs are of high quality. Again, Boss courses are going to help you get to this quality. And just make sure that you do the best, have the right camera, the right equipment, a ring flash to take your photographs, and good retractors. If you are submitting digital models, please make sure you can submit either photographs taken yourself with a camera or digital models as JPEG images, and you can see the different views that we'd like to have a look at. A cephalogram and OPG is essential as well. Please make sure the x-rays are within 12 months of start date, that your cephalogram is in centric occlusion with natural head posture, and your panoramic radiograph is really clear as well. Please summarize this information as step 3. Now, this is much more detailed, and I'm going to go by step on this. So again, complete your Boss coaching template, which is a PDF document. Add all your examination notes, add your preliminary diagnosis, your problem list, your preliminary plan. Now there's a section there to add any unanswered questions or concerns and include any username, access, or website URLs for access to treatment setups. Make sure all your photographs are organized and edited, all your x-rays are sharp and clear, great quality, and you flipped all your mirror images. Okay, now if you have additional information like CBCT images, some supplemental photographs or radiographs, don't let them go to waste. Do provide them to us as well. If you've already gone ahead and done a study model analysis, a Bolton's analysis, or a Ceph analysis, they're all optional, but they will help the case, and you can surely embed them as well. So lastly, don't forget to supply us your digital orthodontic portal logins, whether it be Invisalign, ClearCorrect, Insignia, whatever portal you're using, as per our previous guideline that we just talked about before. Make sure you supply them to us, and it's all accurate information. Your step 4 is to share all that information via Dropbox to info@breakthroughwithboss.com. So submitting all this information, these documents that you filled out and all these images is best done as a PowerPoint or keynote presentation. If you create a page for each photograph or whether you embed all of them together, that doesn't matter. But as long as it's all in one nice, neat file, that would be great. So how we suggest this is create a Dropbox account via dropbox.com, then create a new Dropbox folder with your doctor first and doctor last name, then create a subfolder underneath that with your patient's initials. Now share the main folder, which has your doctor first and last name, to info@breakthroughwithboss.com by right-clicking and simply clicking on share. Please remember, sharing via dropbox.com is not enough. You will have to email us separately to advise us that you've uploaded your case in Dropbox. You will receive an acknowledgement within 2 business days from us. And please allow 7 to 14 days for a full response if it relates to diagnosis and or treatment planning and setup. For level 1, I will actually go ahead and do the digital setup and various version of it, and once it's nearly complete, you will receive my full response. For level 2, what you're going to find is, we might be having several phone conversations along the way, so you can learn my tips and tricks and why we're making certain changes with the technician and what are the reasonings behind it. So again, level 1 is one-time access. We don't do ongoing coaching or mentoring, and it's really for quick, limited access to myself. Level 2 includes all of level 1 plus a 1-hour online session with myself. So a Skype or phone session is generally organized within 14 business days of submission, and I'll be able to share my screen and show you how I'm modifying the clinical setups, the digital setups. I can show you presentations related to the case with my clinical tips and tricks and answer any of your queries or questions. This is a great way for people who do not live in Australia or are far from Sydney or Melbourne or cannot attend courses yet want to continue their learning. And, having each case with its own 1-hour access with me and a lot of phone support would be really phenomenal, I think, for some. So for our annual attendees, of course, there's a lot of opportunities to discuss cases with me, especially when we meet 5 times in the year face to face. But between those 5 times, you have unlimited email access for 2 of your cases. Please allow 2 to 5 business days for such questions. No questions silly. Things like what kind of cement do we use? What instructions do we give? How do I design my upper removable appliance? Where do I order this from? I've just done a quick progress check and, this is not going well or this is going great. All of these are allowed. We recommend to all our annual attendees to update all intraoral photographs and extraoral photographs at least every 3 months and keep adding them to your patient's created PowerPoint or Keynote within Dropbox. When it comes to x-rays, we recommend updating certain x-rays every 12 months. This will already be discussed in your treatment plan. And again, it's to check for root resorption, it's to check for treatment changes. And again, add this to your case's PowerPoint or Keynote that you've created with the date of the x-rays in Dropbox. But don't forget to keep us updated. So once you update all your records, please email us to advise of the updates at info@breakthroughwithboss.com. Well, we thank you very much, and we really hope that you learn more and feel supported with my specialist orthodontist coaching services that I'm offering via Boss programs and global services. So guys, no question is silly. You can email us before you get started. The coaching template, again, if it's not available online as a PDF, you can email us and it will be provided to you to help you fill in all the blanks. And we hope to see you at one of our Boss events. And if not, definitely hope to support you throughout your patient's journey and hoping for a great patient outcome for you via Boss. Thank you very much. Thanks for listening. Bye.